our new product, our launch of new product for the joint health, which is also known as Jiflex. So yeah, these are the key points which we will be talking about today, which includes Jiflex in general and the commonest joint problem due to aging, the ingredients of Jiflex, which include mainly the glucosamine and also MCAR, and what are the special instructions for Jiflex, and in summary. Okay, do you know that the most common joint problem due to aging is mainly known as osteoarthritis? Osteoarthritis is generally a degenerative joint disease that causes pain in the bone and the cartilage and then swelling and loss of motion of the joint. There's loss of normal shape in the long term, and it is different to the rheumatoid arthritis, which is a autoimmune disease. It happens due to the lack of the blood vessel supply, lymphatic drainage, nerve activities, and low level of metabolic activity. So this is what happened in osteoarthritis versus the normal healthy joint. So what happened in an osteoarthritic joint is that the cartilage, if you can see, that it becomes worn away due to trauma or due to wear and tear and due to aging. The spurs will grow from the edge of the bone, and then the synovial fluid will increase. That causes the swelling and joint stiffness. So Jiflex is actually scientifically formulated supplement that combines both natural and effective ingredients that enhances the joint health, reduces the pain, and increases the mobility. Why and how it works? Jiflex works by combining both anti-inflammatory property and also the cartilage repairing ingredients. So it helps to support both short-term relief and to prevent and maintain long-term joint health. It is natural. These are the key ingredients that you can find in Jiflex. I proudly present you the ingredients, which include 50 milligram of boswellia and 100 milligram of the MCAR blend and 50 milligram turmeric and 300 milligram of glucosamine sulfate per tablet. The first ingredient, which includes the 50 milligram of boswellia, this is known for the anti-inflammatory property that reduces the inflammation, hence the joint swelling and also stiffness, and it will improve the flexibility and mobility of the joint. As we all know, turmeric has powerful antioxidant property. It contains curcumin that reduces oxidative stress and inflammation in the joint and then enhances the overall joint health and the mobility. But not last, the glucosamine sulfate, which are essential for maintaining cartilage structure. It helps to repair any damaged cartilage and prevent further joint degeneration. We may skip this slide, sorry. This is the structure of the glucosamine, as you can see from the picture. Okay, it is actually a building block for the extracellular matrix of the cartilage of our joint, and it produces the proteins like glycosaminoglycans and proteoglycans. So it is actually 90% absorbed orally. So whatever tablet, most of the time supplements when we take orally, the absorption rate is probably about 40 to 60%. But as for glucosamine, the bioavailability and the absorption rate by the body is about 90%. The most common form of glucosamine is known as glucosamine sulfate, which we included in our product. Of course, in the market, there are also glucosamine hydrochloride, glucosamine hydroiodide, but the absorption rate of this form of glucosamine is much lesser as compared to glucosamine sulfate. It is commonly used with MSM, which we do include it in our product, which is a sulfur compound, right? Which is essential to stabilize the connective tissue and increase the protein matrix in our cartilage. It is sourced from meat, poultry, fish, and it is being synthesized in the body. And we manufacture it from chitin, which is a substance found in shrimp, crab, or lobster shells. And the synthetic glucosamine is also available. The recommended dose for maintenance is actually between 500 milligram to 1,500 milligram per day to a maximum dose of 2,000 milligram per day for adults. As for children, unfortunately, there is not enough clinical data to state that it does help. However, we usually recommend taking the MSM. There are multiple clinical studies that have consistently reported that glucosamine is being safe. There are no allergic reactions have been reported, even glucosamine is derived from shellfish. So people who are allergic to shellfish might be a bit cautious while taking glucosamine, but they do not cause any acute life-threatening diseases. However, to take note, patients with uncontrolled sugar level or diabetic, they would need to consult the doctor before taking glucosamine products. Okay. Taking glucosamine together with certain drugs might increase the potency or the efficacy of the drugs, hence also increases the side effect of the drug. These are included diuretics like classic, yeah. And if you are on any anticoagulant like warfarin, aspirin, patient with heart diseases who are on Plavix, we would recommend to reduce. Instead of taking twice a day, we would recommend you to take 2 tablets once a day. These are a clinical study which is combined. There are comparison between glucosamine, chondroitin sulfate, and the two in combination in treating painful osteoarthritis. And these are from the New Journal of Medicine, done at 2006. So this glucosamine has been way long in the market. So the objective of this study is to study the efficacy and the safety of a treatment for knee pain from osteoarthritis. So what happened is that this study actually comprises 1,583 patients who have symptoms of knee osteoarthritis, and it was backed up by knee x-ray. Now these people, they are put on 1,500 milligram of glucosamine and 1,200 milligram of chondroitin sulfate, and both glucosamine and chondroitin sulfate, and category 4, those patients who are on celecoxib, which is a form of NSAID, a type of painkiller. And the last category are those who are on placebo, which means they are not on any sort of treatment. Now, this study was conducted over the 24 weeks time, and people who are participating in this clinical trial, those are people who are above the age of 40 years old and on an average age of 59 years. Now, 64% of these people participating in this controlled trial are women. They are divided into further into three different groups, which are the mild, moderate, and severe groups. Now, they were evaluated at first month, second month, fourth month, and also sixth month. Okay. Okay. So the results of this study shows that participants, they have been using much lesser painkiller per day. That's number one. Number two, those who are on celecoxib, those who required very strong anti-inflammatory medications, there was more than 20% reduction in 70% of the people. Now, 60% in the placebo have no significant differences. So for the people who are between the moderate to severe pain with glucosamine and chondroitin sulfate, 79% of people have improvement. Now, those in mild pain, 62.9% of people who are on supplement has improvement. Now, only 77 people out of these 1,538 participants have reported mild side effects, which are negligible. Our main ingredient, the MCare blend, 100 milligram, it is a blend designed for joint lubrication. It reduces the discomfort by reducing the friction between the joints. It also promotes smoother joint mobility and long-term flexibility. So MCare actually contains a significant amount of cysteine-rich proteins, which are nutrients that's responsible for cell regeneration for the skin, the hair, and the nails too. As we age, we lose elasticity from our skin. There will be appearance of wrinkle and loss of firmness. The skin becomes dehydrated and hence the color become very dull. So this is a pilot study that was conducted to test the effectiveness of this MCare on cell regeneration for our skin. The participants are being divided into two categories. The first category are those who are taking MCare 300 milligram, and the other one, the placebo 300 milligram. And this study was conducted over 28 days. It was a previous slide. And what we can see is that from comparison of the hydration and also firmness, compared to the placebo, it has been increased by 39%, and the firmness of the skin has been increased by 20%. And this is to test for the skin hydration, the skin brightening, and also the hair loss. As you can see, the comparison between the MCare and the placebo. The placebo has negative effect, while the MCare has between 30 to 63% of increase in helping hair loss, skin brightening, skin hydration. These are the clinical study case 2, which was also done on aged skin. And in this case, it was given 3 types of groups. The first group are those who are taking MCare 300 milligram. The second group are those who are on hydrolyzed collagen, 8,000 milligram, while the third one will be on placebo 300 milligram. And the study was both done for 28 days and 57 days. And with this, you can see the cutometer was used to check for the firmness and skin overall elasticity. And as compared to people who were taking placebo and also hydrolyzed collagen, those who are on MCare, there's a positive effect of between 14 to 35% after evaluating within 28 days and also 57 days. And as compared to the negative effect brought on by the hydrolyzed collagen and also the placebo. Also, you can see from here, the barrier function of the MCare has been well evident by less water loss from the skin by 21% for those who are actually taking MCare, while those who are on the hydrolyzed collagen, there is reduction by 8%. So you can see the effectiveness, which is 3 times of those who are taking the hydrolyzed collagen. So in general, what is MCare? MCare is actually a branded ingredient that is natural based, 100% from the eggshell membrane from Spain. It is rich with collagen, hyaluronic acid, chondroitin sulfate, glucosamine, elastin, and over 400 proteins that is necessary for our skin, our joint, our hair, our bone health. And naturally, it contains multiple key bioactive compounds that work well and beneficial to the joint health and also skin health. So you can see for those who are on placebo, degraded membrane, and those who are on MCare, you see the comparison. So, however, because it is sourced directly from the fresh eggshell membrane, so you can see the difference and the efficacy of MCare compared to the degraded one is by at least 10%. So multiple general studies have been done to prove the efficacy of eggshell membrane. So MCare gives a better efficacy compared to degraded membranes, and in terms of pain improvement, joint stiffness, and also the mobility. So MCare reduces the pro-inflammatory cytokines in human chondrocytes, which is the joint, and also stimulates the joint components like collagen, glycosaminoglycans, proteoglycans. So, I mean, like I say, let's re-emphasize the difference of MCare from other membranes that's available on the market. It is less bioburden in the raw material and in the final product. produced on the site with no storage. So why should we choose fresh membrane versus the degraded membrane? As you can see that the fresh membrane contains from MCare actually contains collagen, hyaluronic acid, elastin, chondroitin sulfate, and glucosamine, and much more, 400 types of proteins that would combine into a perfect matrix that will help in a single ingredient. It also helps to maintain double the soluble proteins, hence increasing the effect of its anti-inflammatory. Next. So you can see from this clinical study, it also helps to reduce this pro-inflammatory cytokines or marker. We call it tumor necrotic factor alpha. Now, this causes the inflammation, swelling, redness, and pain of the joint. So by taking the MK, you can see there is at least 50% reduction in the concentration of these pro-inflammatory markers. It also increases the production of aggregates and also type 2 collagen, when you can see in the chart, in the graph, by 50 to 70%. Next. So, but if you can see, these are actually done on hydrolyzed membrane, that means the degraded ones. Yeah. So the tumor necrotic factor, which is the pro-inflammatory markers, has reduced by lesser as compared to those with the fresh membrane. This graph shows that the MCare also reduces the interleukin-1 alpha, which is also a type of pro-inflammatory marker. And next, also an inflammatory marker, which is interleukin-6, will be also reduced by MCare. And it increases the induction of agricocano, which is a type of peptide protein. So most importantly, you just need to remember two key points of the MCare. It helps to reduce the pro-inflammatory cytokines in the human joint. So we are still researching MCare. I think there's, as you can see from the next control trial, can we see the next slide, please? Yes. So these are people who are taking placebo, MCare, and those with the degraded membrane. You can see the red ones are the ones that were taking MCare, and the pain reduction in 30 days is by 50% and 60 days by 60%. And it also reduces this joint stiffness by 44% in 30 days and 40% in 60 days. Next. So how should we take Jflex? The recommended dose will be 2 capsules in the morning and 2 capsules at night.
Мы рекомендуем принимать препарат, соответственно, режим 2 капсулы утром, либо 2 капсулы вечером.
For patients who are taking the diuretics like Lasix or anticoagulant like aspirin or Plavix, it is recommended to take 2 tablets in the morning. So with Boswellia, turmeric, MCare, and glucosamine, Jflex definitely provides the ultimate joint health solution. So try Jflex today and enjoy pain-free movement and an active life. Thank you, everybody, for your patience. And should you have any question, you can drop your question. We will take it down and we will answer you during the next Zoom.